All right, so today we'll be talking about a couple of women who have made leaps and bounds in the world of medicine. And be sure to remember that while these are some well known women, they are not at all the only ones who have been contributing to the growth of women in STEM. So, up first, we have Elizabeth Blackwell. She was the first woman in America to receive a medical degree, and she championed the participation of women in the medical profession and ultimately opened her own medical college for women. Born near Bristol, England on February 3rd, 1821, Blackwell was the third of 9 children of Hannah Lane and Samuel Blackwell. She was inspired to pursue medicine by a dying friend who said her ordeal would have been better if she had had a female physician. Most male physicians trained as apprentices to experienced doctors. There were few medical colleges and none that accepted women, though a few women also apprenticed and became unlicensed physicians. Rejected everywhere she applied, she was ultimately admitted to Geneva College in rural New York. However, her acceptance letter was intended as a practical joke. Blackwell faced discrimination and obstacles in college. Professors forced her to sit separately at lectures and often excluded her from labs, and local townspeople shunned her as a bad woman for defying her gender role. Blackwell eventually earned the respect of professors and classmates, graduating first in her class in 1849. She began to emphasize preventative care and personal hygiene, recognizing that male doctors often caused epidemics by failing to wash their hands between patients. In 1851, Dr. Blackwell returned to New York City, and with help from Quaker friends, she opened a small clinic to treat poor women. In 1857, she opened the New York Infirmary for Women and Children with her sister, Dr. Emily Blackwell, and colleague, Dr. Marie Zakrzewska. Its mission included providing positions for women physicians. During the Civil War, the Blackwell sisters trained nurses for Union hospitals. In 1868, Blackwell opened a medical college in New York City. A year later, she placed her sister in charge and returned permanently to London, where in 1875 she became a professor of gynecology at the new London School of Medicine for Women. She also helped found the National Health Society and published several books, including an autobiography, pioneer work in opening the medical profession to women. So our second woman today is Tanja Tandon. Tandon discovered an interest in science when she learned that her siblings suffered from eye conditions. She and her siblings were each encouraged to try various science experiments, and her siblings also pursued careers in scientific fields. As a child, she enjoyed taking apart TVs and building giant Tinker Toy towers, playing with static electricity, and experimenting on her class for science fairs. Tandon attended college at Cooper Union, graduating with a Bachelor of Electrical Engineering in 2001. The Cooper Union for the Advancement of Science and Art, commonly known as Cooper Union, is a private college in New York City. While completing her undergraduate education, she built an electronical musical instrument which is played through human bodies' electromagnetic waves. From 2003 to 2004, Tandon attended the University of Rome Tor Vergata, having received a Fulbright scholarship. There, she worked on the development of LibriNose, analyzing patient breath samples to determine the feasibility of a non-invasive cancer smelling device. In 2006, she graduated from MIT with an MS in electrical engineering, having received an MIT Presidential Fellowship in 2004. In 2006, she started graduate work at the Boston School, and she quickly changed to follow her mentor, Professor Gordana Novakovic, who is a biomedical engineer and a university professor at Columbia University, as well as the Mikati Foundation Professor of Biomedical Engineering and Medical Sciences. She also heads the Laboratory for Stem Cells and Tissue Engineering at Columbia. She then studied Tandon then studied at Columbia University, graduating in 2009 with a PhD in biomedical engineering, with a concentration in cardiac tissue engineering. Tandon stated that her career path was inspired by relatives and was a process. At Columbia, she began creating human tissues. She also received an MBA from Columbia in 2012. She said that she wanted to bridge the gap between the possibilities of her research and actually making them happen, and this is made possible with a business degree. As a biomedical engineer, Tandon worked at Columbia University to force growth and stimulation of cells using electrical currents. Currently, she has grown cells on rat hearts to beat, but her ultimate goal is to have the ability to create a process where scientists can grow entire human organs. She later co founded EpiBone and currently serves as the company's CEO. They work on developing technology to create bone tissue from a patient's mesenchymal stems in vitro for use in bone grafts. She has also co-written a book, Supercells: Building with Biology, that I suggest you check out if you are interested in her work. Tandon is one of the more recent women who have made these amazing breakthroughs, showing how women continue and have always been a necessary part to learning and advancement.